Well, now to the front lines of the COVID battle and an urgent call for governments to take more drastic steps to counter the third wave as the healthcare system in some provinces is being overwhelmed. And when we say the system, we really mean people in the system, those frontline workers. They make the system run. Vicki McKenna is a registered nurse and the president of the Ontario Nurses Association, and she is with me now. Vicki McKenna, thanks for taking time to speak with me today. Give me a sense of what's happening to nurses who've assumed so much of the burden of caring for the growing numbers of COVID patients in hospital. What's happening with them?
Well, absolutely they have, and it's it's been such a long period of time to be working at the intensity that they are and in the situations that they are. So here in Ontario, and I think most people, watching the news certainly know this, is particularly right now in our hospital system, which has been taxed all the way through these numbers of months, is in overcapacity. And, so many patients who are so desperately ill. And they are, I'll just say, they're exhausted. They're physically and mentally exhausted, but they are doing the very best they can in the situation that we're all in. But aside from that, what they tell me is that they feel that, it's hard for them to see the light at the end of the tunnel. And it's very difficult right now.
Ontario is said to be close now to enacting the triage protocols to decide who gets intensive care treatment when it's needed and who doesn't, because there are too many patients to treat at any single time. How close are we to seeing that in Ontario?
Well, I hear various reports from the field about this, and some of the ways the hospitals are dealing with it is because of capacity. They're trying to open more beds so they can admit more people or transfer people across, and they are transferring people across the province in order to build capacity. No one wants to be in a situation of triage protocols. We hope we never get there, but I do hear, and I've heard some of the physicians speaking particularly on the media and at various meetings, that they're worried. They're worried that we may be reaching that point. ICU admissions continue to grow, and right now it's precarious, I would say, for everyone. And
people need to make the link, right, between when they open tent hospitals, satellite hospitals, they open more beds. There need to be frontline professionals to deal with those patients, right? And that's the big strain.
That is the huge strain. And what the nurses are telling me is that, in normal, whatever, almost everyone forgets what that was, is that they would have a certain number of patients they'd be expected to care for, and particularly in our ICUs would be one-on-one or two patients max. But I will say that it's well beyond that. Opening extra beds is not giving us more staff, and that is really critical. Absolutely.
What more do you expect governments to do to ease this strain?
Well, certainly, some of the measures that have been put in place, I think, are helping to alleviate some of that. And I already mentioned around moving patients around. We're hearing about redeployment of nurses from other institutions and from other sectors within healthcare into the hospitals. There's a number of things that are happening, but it doesn't. It isn't adequate yet. We're not at a point where we could take a deep breath and say, okay, we're there. We're not there. And there's a lot of movement happening. Certainly, even calling out to other provinces and other countries, apparently they're doing that. But what's happening right now on the ground, the relief isn't there yet. But redeployment is happening. But it's a really uncomfortable situation for nurses to come from a sector where they've never been, and coming in and they're doing the best they can with what they have.
Let me ask
and
you
the skills they bring.
Yeah, let me ask you a little bit more about that. We know Ontario is getting help from the military, as is Nova Scotia.
Right.
Ontario is getting, as you mentioned, a few extra healthcare workers at this point from Newfoundland and Labrador. Other provinces may be able to step up, but how realistic is it to believe that other provinces will be able to provide a whole lot to Ontario?
Well, I've been on national calls with nursing leaders across the country, talking just about that and what capacity level they're at. We're not alone in the situation here in Ontario, but ours is what I believe to be the worst. However, the others are building and worry about, sending people and then really needing them back. So it'll be a careful balance. It'll be decisions that need to be made in those provinces, whether they can actually release people to come and then still be able to hold the fort back in their home province.
Let me finish on this. A lot of people have talked about the need for a better paid sick leave offering in a number of different provinces. Ontario sort of in the headlines these days. What difference will 3 days of paid sick leave make to help curb the spread, do you think?
Well, first off, it's not enough. I mean, we've heard from leading healthcare professionals, physicians, epidemiologists, even the science table here in Ontario talking about, looking for 10. And the reason they're looking for 10 is that's the basic isolation period when someone's been forced off work. And or if someone's been diagnosed as being positive COVID. We have to stem the flow. We have to stop the cases. We have to bring the numbers down. And many, many people are forced to go to work. And they can't afford not to. They are the sole provider for their families. So 3 days is a start, but, in the long run, will it actually make an impact? I don't know. But we need to, yes, get people vaccinated, but we also have to allow them to care for themselves and their families. And even for nurses, there's many nurses who have not been eligible for any sick pay because they don't have those benefits in their collective agreement or their contract.
Right.
When they're put off work, they're off work without pay. And it's such a muddle of different programs really out there right now. It needs to be simple. This one is they don't have to apply, which will make a difference, I think, for people. Employers will then be reimbursed. But it's a start.
All right. Well, thanks so much for giving us your perspective, and to you and your colleagues, stay safe, and know that a lot of people, everybody appreciates the work you're doing on the front lines. Thank you so much.
Well, thank you very much, and everyone do that. Please stay safe and follow the protocol. Thank you.